Chapter 10, Dictation 10T-1. 1. Afebrile is without fever, period. He is palpably afebrile, period. 2. Amaurosis is the loss of sight without the apparent lesion of the eye, period. She has noted some intermittent visual symptoms in her left eye, semicolon. However, comma, I would not clearly call it amaurosis fugax, period. 3. Aneurysm is a localized, abnormal dilatation of the wall of a blood vessel, period. The physician felt no abdominal aortic aneurysm, period. 4. Angiography is the radiographic visualization of a blood vessel after injecting a contrast agent, period. The patient requires a coronary angiography, period. 5. Arrhythmia is the variation from the normal rhythm of the heartbeat, period. She has a history of hypertension, comma, glaucoma, comma, and arrhythmia, period. 6. Arteriography is the radiography of an artery after injection of a contrast medium in the bloodstream, period. Combined coronary arteriography with cerebral angiography would be appropriate, period. 7. Atherosclerotic is the hardening of an artery due to deposits of plaque within the vessel, period. She has a family history of atherosclerotic disease, period. 8. Atrial pertains to the atrium, period. She has a history of chronic atrial fibrillation and sleep apnea, period. 9. Bradycardia is a slow heartbeat, period. An electrocardiogram revealed bradycardia, and a junctional rhythm was documented, period. 10. Bruit is a sound or murmur heard in auscultation, period. The abdomen contains no masses and no bruits, period. 11. Cardiomyopathy is the disease process of the heart muscle. Period. The patient is a 35-year-old with documented cardiomyopathy. Period. 12. Cardioverter is a device used to administer electrical shocks to the heart. Period. The patient was given intravenous diuretics and readjusted her medicines to try to medically or electrically cardiovert her. Period. 13. Carotid relates to the principal artery of the neck. Period. Carotid bruits are not heard. Period. 14. Cholecystectomy is the surgical removal of the gallbladder. Period. She is scheduled next Wednesday morning for a laparoscopic cholecystectomy and possible open cholecystectomy. Period. 15. Claudication is the cramp-like pains in the calf, semicolon, limping, period. She has a history of peripheral vascular disease and is status post left iliac angioplasty with good results and no residual claudication. Period. 16. Collateral is a secondary or accessory blood pathway. Period. This is a 68-year-old male with single vessel coronary involving the left circumflex and bridging collaterals on the right coronary artery. Period. 17. Cyanosis is a dark bluish or purplish coloration of the skin due to deficient oxygenation of the blood. Period. No cyanosis or edema noted. Period. 18. Diaphoresis is perspiration. Period. He developed chest pain suddenly 2 hours ago with diaphoresis and nausea. Period. 19. Digoxin is a generic name for a cardiotonic. Period. Her medications included digoxin 0.125 milligrams daily and a laxative. Period. 20. Diltiazem is a generic name for a coronary vasodilator. Period. She denies hypertension, comma, although she is on diltiazem at the time of her arrival in my office. Period. 21. Dobutamine is a generic name for a cardiotonic agent. Period. He was recently hospitalized several weeks ago for intravenous dobutamine therapy. Period. 22. Duodenal relates to the duodenum, comma, the first division of the small intestine. Period. She has a history of peptic ulcer disease and a bleeding duodenal ulcer. Period. 23. Dysrhythmia is a defective rhythm. Period. She has a history of cardiac dysrhythmia in the past. Period. 24. Echocardiogram is a diagnostic procedure using ultrasound to study heart structure and motion. Period. She had an echocardiogram and Holter monitor exam at that time. Period. 25. Endarterectomy is a surgical procedure done to clear a blocked artery. Period. The patient underwent coronary artery bypass grafting on August 18, 1996, with right carotid endarterectomy at the same time. Period. 26. Epiphysis is the center for ossification at the proximal and distal ends of a long bone. Period. The patient's past medical history was significant for open reduction internal fixation of the right hip for what sounds like slipped capital femoral epiphysis disease. Period. 27. Erythema is the redness of the skin due to capillary dilatation. Period. There is minimal erythema. Period. 28. Expiratory relates to exhalation. Period. There is a moderately slight, prolonged expiratory phase. Period. 29. Fibrillation is the exceedingly rapid contractions of muscular fibrils. Period. She has a history of chronic atrial fibrillation and sleep apnea. Period. 30. Gallop is a triple cadence to the heart sounds. Period. There are no significant murmurs or gallops. Period. 31. Gout is a disorder associated with an inborn error of uric acid metabolism that increases production or interferes with the excretion of uric acid. Period. The patient also has a history of gout. Period. 32. Hemiblock is the failure to conduct an impulse down one division of the left bundle branch. Period. The electrocardiogram shows a left anterior hemiblock, comma, normal sinus rhythm, comma, and premature arterial contractions. Period. 33. Hemoptysis is the coughing or spitting of blood from the respiratory tract. Period. Negative for cough sputum or hemoptysis. Period. 34. Heparin is a generic name for an anticoagulant. Period. The patient is refusing to consider intravenous heparin or any form of IV therapy or blood work. Period. 35. Hypercholesterolemia is the presence of an abnormally large amount of cholesterol in the cells and plasma of the blood. Period. The patient is a 56-year-old gentleman with a history of chest pain, comma, with negative evaluation in the past, comma, and hypercholesterolemia. Period. 36. Hyperkalemia is the greater than normal concentration of potassium ions in the blood. Period. He has hyperkalemia with an elevated potassium at 7.7. Period. 37. Hyperlipidemia is a condition of elevated lipid levels in the blood. Period. The patient also has a history of mild hyperlipidemia and gout. Period. 38. Hypotensive is characterized by low blood pressure or causing a reduction in blood pressure. Period. The patient would get so weak, comma, dehydrated, comma, and hypotensive that her diuretics would be cut back, period. 39. Idiopathic is a disease of unknown cause, period. The patient is a 35-year-old with documented idiopathic cardiomyopathy, period. 40. Iliac relates to the ilium, period. She has a history of peripheral vascular disease and is status post left iliac angioplasty with good results and no residual claudication, period. 41. Infarction is the sudden insufficiency of arterial or venous blood supply, period. He presented to the University Hospital emergency room and an acute inferior infarction was noted by the ECG, period. 42. Inferolateral pertains to a location situated below and to the side, period. Testing shows anteroapical and inferolateral anemia, period. 43. Inotropic pertains to the force of muscular contractions, period. Parenteral inotropic agents will again be employed, period. 44. Intimal relates to the inner coat of a vessel, period. In August 1994, comma, the patient did have a heart catheterization that demonstrated decreased left ventricular function and intimal coronary artery disease, period. 45. Ischemia is the decreased supply of oxygenated blood to a body part, period. His 12-lead ECG shows no evidence of transmural ischemia, period. 46. Mediastinum is the mass of tissues and organs separating the sternum in front and the vertebral column behind, period. Mediastinum looks normal size, period. 47. Myocardial pertains to the muscular tissue of the heart, period. The patient's chest discomfort could certainly be attributed to myocardial ischemia and infarction, and this should be excluded. Period. 48. Normocephalic is the normal size of the head. Period. The head is normocephalic, comma, atraumatic. Period. 49. Nortriptyline is a generic name for an antidepressant. Period. The patient's medications included nortriptyline 50 QHS. Period. 50. Paroxysm is the sudden reoccurrence or increase in intensity of symptoms. Period. She has a history of paroxysmal atrial fibrillation and chronic atrial fibrillation. Period. 51. Pectoralis pertains to the chest or breast. Period. There has been no definite angina pectoralis nor definite symptoms related to his right carotid lesion. Period. 52. Pedal pertains to the foot or feet. Period. There is 1 plus pedal edema. Period. 53. Pitting is the formation of a small depression. Period. She has 4 plus pitting edema of her lower extremities bilaterally. Period. 54. Pleura is the serous membrane investing the lungs and lining the walls of the thoracic cavity. Period. She denies shortness of breath or pleuritic chest pain. Period. 55. Polycythemia is an increase in the total red cell mass of the blood. Period. The patient has a history of polycythemia secondary to her COPD. Period. 56. Quinidine is a generic name for an antiarrhythmic agent used in the treatment of atrial flutter, comma, atrial fibrillation, comma, premature ventricular contractions, comma, and tachycardias. Period. The patient was medically converted with quinidine and she improved. Period. 57. Rhonchus is a continuous dry rattling in the throat or bronchial tube due to a partial obstruction, comma, heard on auscultation. Period. Occasional rhonchi are present in the chest. Period. 58. Sinus is a cavity or channel. Period. ECG was done and appears to be normal sinus rhythm. Period. 59. Stenosis is the narrowing or contraction of a body passage. Period. A carotid sonogram documents an 80% to 99% stenosis in the left internal carotid artery. Period. 60. Syncope is a temporary suspension of consciousness, semicolon, fainting, period. The patient denies dizziness, comma, lightheadedness, comma, or syncope, period. 61. Tachycardia is an abnormal, rapid heart rate. Period. The physician ruled out supraventricular tachycardia. Period. 62. Thrombosis is the formation of a blood clot within the vascular system. Period. The question of deep venous thrombosis has been raised. Period. 63. Venous pertains to the veins. Period. Venous pulses are unremarkable. Period. 64. Verapamil is a generic name for a coronary vasodilator. Period. He has been on verapamil therapy. Period. 65. Capitan is the trade name for an antihypertensive. Period. The patient's medications included Capitan 12.5 milligrams TID. Period. 66. Cardiolite is the trade name for myocardial perfusion agent for cardiac SPECT imaging. Period. Prosantine IV cardiolite shows anteroapical and inferolateral ischemia. Period. 67. Cardizem is the trade name for a calcium channel blocker for atrial fibrillation. Period. His medications include Cardizem 60 TID and aspirin. Period. 68. Coumadin is the trade name for an anticoagulant. Period. She has a history of paroxysmal atrial fibrillation, comma, chronic atrial fibrillation and is on Coumadin at home, period. 69. Cytotec is the trade name for an anti-secretory, gastric protectant for the prevention of non-steroidal anti-inflammatory drug-induced gastric ulcers, period. The patient's current medication is Cytotec 100 milligrams daily, period. 70. Ecotrin is the trade name for an analgesic, anti-inflammatory, period. Her medications include Ecotrin 1 QD, period. 71. Indocin is the trade name for a non-steroidal anti-inflammatory drug, period. The patient's current medications are Indocin 25 milligrams daily and Cytotec 100 milligrams daily, period. 72. Iserdil is the trade name for an anti-anginal, period. His medications included Cardizem 60 milligrams TID, Iserdil 20 milligrams TID, and aspirin, period. 73. K-Dur is the trade name for a potassium supplement, period. The patient's current medications are Capitan 12.5 milligrams TID, K-Dur 20 milliequivalent BID, and Digoxin 0.125 milligrams daily, period. 74. Lanoxin is the trade name for an antiarrhythmic, cardiotonic that increases cardiac output, period. The patient's medications included Coumadin per prothrombin times at home and Lanoxin 0.25 milligrams QD, period. 75. Lasix is the trade name for a diuretic, period. She will have her Lasix increased, and start on nitrates, period. 76. Lescol is the trade name for a reductase inhibitor for hypercholesterolemia, period. The patient's medications included Ecotrin, 1 milligram QD, Lescol, 20 milligrams QD, and nortriptyline, comma, 50 milligrams QHS, period. 77. Lotensin is the trade name for an antihypertensive, period. The patient was prescribed Lotensin, comma, 1 tablet daily, period. 78. Mevacor is the trade name for a reductase inhibitor for hypercholesterolemia, period. The patient's current medications included Cardizem 60 milligrams TID, comma, Mevacor 20 milligrams, comma, Iserdil 20 milligrams TID, comma, and aspirin, comma, which was stopped 6 days prior to surgery, period. 79. Persantine is the trade name for a coronary vasodilator, period. Persantine IV cardiolite shows anteroapical and inferolateral ischemia, period. 80. Premarin is the trade name for estrogen replacement therapy, period. Her current medications include Premarin, period. 81. Provera is the trade name for progestin for secondary amenorrhea and abnormal uterine bleeding, period. Her current medications include Premarin and Provera, period. 82. Quinadex is the trade name for an antiarrhythmic, period. The patient's current medications include Capitan 12.5 milligrams TID, comma, K-Dur 20 milliequivalent BID, comma, Quinadex 300 milligrams BID, and Digoxin 0.125 milligrams daily, period. 83. Reglan is the trade name for a gastrointestinal stimulant, semicolon, antiemetic, period. The patient had a history of intolerance to Reglan, period. 84. Senokot is the trade name for a laxative, period. Her medications included Digoxin 0.125 milligrams daily and Senokot, period. 85. Synthroid is the trade name for a thyroid hormone, period. The patient's medications included Synthroid, comma, 0.1 milligrams QD, comma, Ecotrin, comma, 1 milligram QD, comma, Lescol, 20 milligrams QD, and nortriptyline, 50 milligrams QHS, period. 86. Tenormin is the trade name for a beta blocker, antihypertensive agent, period. The patient's current medications are Tenormin, 12.5 milligrams BID, Indocin, 25 milligrams daily, and Cytotec, 100 milligrams daily, period. 87. Terramycin is the trade name for an antibiotic, period. The patient is allergic to terramycin, period. 88. Theodur is the trade name for a bronchodilator, period. The patient's medications included Coumadin per prothrombin times at home, Lanoxin 0.25 milligrams QD, and Theodur 300 milligrams BID, period. 89. Trentol is the trade name for an oral hemorrhagic drug, period. The patient's current medications are vitamin E, vitamin C, Trentol, beta-carotene, and Centrum Silver 1 tablet daily, period. 90. Vasotec is the trade name for an antihypertensive agent, period. She will be continued on her Vasotec, have her Lasix increased, and start on nitrates, period. 91. Xanax is the trade name for an anti-anxiety agent, period. Her current medications include Xanax, Premarin, and Provera, period. 92. Xyloprim is the trade name for an anti-gout agent, period. The patient's current medications are vitamin E, vitamin C, Trentol, beta-carotene, Centrum Silver 1 tablet daily, and Xyloprim, period. End dictation.